Hi, everyone. Thank you for joining us for our webinar today about broadening the apprenticeship pipeline. My name is Katie Spiker. I'm Senior Federal Policy Analyst at National Skills Coalition, and I'm joined by three of my colleagues. The first is our State Policy Director, Melissa Johnson, also from National Skills Coalition, as well as Julie Kuklinski, who's the Program Director at More Community Houses Women in Construction Program, and Matt Williams, who's Director of Research at Mississippi Low-Income Childcare Initiative. We are going to talk today about how to broaden the apprenticeship pipeline by focusing on access and improving resources for pre-employment programs like pre-apprenticeship and extending access to affordable childcare for program participants and for apprentices. In the United States, 53% of jobs are middle skill, which require some sort of education beyond a high school diploma, but not a four-year degree, and yet only 43% of workers are trained at that level. This unmet demand for skills is a lost opportunity for businesses who can't take advantage of economic growth and means that workers aren't able to access those good jobs. Apprenticeship and work-based learning can help address this disconnect. These are the kind of programs in which workers earn wages while they develop skills. Businesses gain a worker on site for whom they can customize their training to meet business demand. The strategy has been known and has been shown to lead to improved retention. It reduces turnover, employees have higher levels of engagement. But despite all of these benefits, the United States falls far behind competitor nations in utilizing apprenticeship and work-based learning. We'll focus the conversation today on some of the reasons for the way that we fall behind our competitor countries, which is really in how we're offering access to apprenticeship, pre-apprenticeship, and childcare that can ensure workers have access to and success in work-based learning programs. We'll spend the next hour in a moderated discussion with about 40 minutes when I'll ask questions, and we'll talk a little bit among the panelists. And then I'll turn it over to questions that we get from the audience throughout the webinar. You can share your questions in the Q&A box, which is in every participant's toolbar. And we'll be recording this webinar, and we'll send an email with the slides and any information after the webinar is completed. So feel free to submit those questions throughout the conversation as we go. But we'll start at a really basic point. So we talked a little bit, I shared a little bit about the way that the United States underutilizes programs like pre-apprenticeship to help broaden the apprenticeship pipeline. Julie, can you share a little bit about what we mean when we say pre-apprenticeship?
Yeah, of course. So pre-apprenticeship programs and training programs are structured in many different ways, but essentially they're a program that prepares somebody to get into an apprenticeship program, so really an on-ramp into an apprenticeship program. They're built around the needs of both the participants and employers in apprenticeship programs, and generally they're intensive short-term programs that are modeled around industry needs that last around 2 to 3 months, where there are cohorts of participants that earn industry-recognized credentials, and they get hands-on technical training. They're able to explore job sites, visit apprenticeship programs, and also have a layer of training around professional development with classes like resumes and interviewing. And essentially, many of these pre-apprenticeship programs nationally are very comprehensive and look at the supportive service needs of the participants as well.
And right now there's a slide up and folks see a couple of the pictures from the pre-apprenticeship program that you run. Can you tell us a little bit more about that?
Yeah, of course. So we are the More Community House Women in Construction program, and our agency, More Community House, was founded in 1924. And we have two programs. One is our Early Head Start program that looks at the child care needs of women, and also the Women in Construction program, which is a job training program. And we're centered at economic security for women. And so we were launched in 2008 as a need for women to get into good jobs, and also for the coast to rebuild after Hurricane Katrina. And we are one of the only pre-apprenticeship job training programs in the South, and we are focused on getting women into the high wage careers and apprenticeship and non-traditional occupations, and really to support industry with those qualified and skilled workers that they need. And of course, we provide career and technical training, but also our participants get industry recognized credentials that qualify them to get into the apprenticeship programs. And we were very fortunate in 2016 to be awarded a grant to also include childcare into our program model. So through the Department of Labor, we received a Strengthening Working Families Initiative grant, and through the Mississippi Department of Human Services, we're using TANF funds to get our students into training, but support them upon the day of enrollment that they have childcare for a year, which is a game changer for both industry and for women looking to participate.
That's incredible. Melissa, can you share a little bit more broadly and from the national level and 30,000 feet about the role that childcare assistance in training and enrollment has in folks' success in those kind of programs?
Sure. So childcare assistance, as Julie was just saying, is a game changer. It's vital when you look at the numbers across the nation. We know that parents make up a third of the workforce, and more than 2/3 of participants in job training programs with low income have children under the age of 6. And then expense can be a very significant barrier to enrolling in a training program. We know that child care expenses for families with young children average more than $700 a month nationally. And that doesn't account for local differences in child care costs or the age of children, so that number, of course, can go up. And at the same time, we know that when parents do receive child care assistance, it can be this bridge to training enrollment, and that's what we touch on in the report. Numerous studies show the benefit of child care, and in one survey that we highlight in the report, nearly half of participants in job training programs with low income who received child care said they would not have been able to complete their training program without access to the support.
It's pretty stark. And I should say, because I didn't say at the very beginning, the report that you mentioned was a report that National Skills Coalition released a couple months ago called Broadening the Apprenticeship Pipeline. That was the jumping off point for the conversation that we're having today, in which we feature a number of federal and state recommendations for expanding access to child care and pre-apprenticeship programs that builds off of Mississippi Women in Construction program and some of the research that Matt's done on some of this need in Mississippi. Matt, can I turn to you to share a little bit more in depth about what the child care need looks like in Mississippi?
Sure. So the child care need in Mississippi, as everywhere, is great. Women in Mississippi make up half of our state's workforce, yet they represent more than 2/3 of our state's minimum wage earners. And when we look at different family types in Mississippi, we note that the median income for single moms with young children is drastically lower than any other family type, and that these are the families that really need full-day affordable child care. We know that child care costs a single mom-headed family for just one infant in full-time care as much as 25% of her median income. And if you have an infant and a toddler, child care costs could easily and quickly take up half of a single mom's income here in Mississippi. So we also note that the available programs that provide child care as a work support for low-income working parents are not adequately funded at the federal level, and there's also limited state investment. And when we look at we know that federal programs like the Child Care and Development Fund typically serve about 10 to 20% of eligible children in a state. But even when we take the sort of widest perspective on the early childhood universe and what services are reaching what children, we note that even when you look at CCDF and when you look at Head Start and early Head Start. And when you look at even public pre-K, our estimates are that about 70% of children are not reached by any kind of early childhood program, whether you're looking at young children, children between the ages of 6 and 12. The need just far outpaces the resources to meet the need. And so affordable childcare options are very limited for Mississippi's working moms and working parents. But it's the childcare that, as was already mentioned, makes the biggest difference in a parent's ability and a single mom's ability to achieve economic security. So when we are looking at the state systems, it's extremely important to align programs like the Temporary Assistance for Needy Families program. In our state, it's called the TANF Work Program, and with other systems like WIOA and SNAP, and really looking even more broadly at all funding sources that we can possibly align and use to fund support services, namely childcare for single moms, to increase their economic mobility and fill in-demand jobs in the state. And the other really important approach is not just offering support services, but training in a field and an on-ramp in a field that's going to really increase the mom's wages. And that combination of services, childcare and work supports, combined sort of with a training pathway that demonstrates a higher wage upon completion, is really a combination of services that is working for moms that Julie's program serves, but it's also an approach that we advocate to sort of make, to sort of entrench in our statewide approach.
That's awesome background. So Julie, I want to turn back to you to get a little in the weeds about how you're actually funding some of this programming, and Matt, you hit on this a little bit. So you're funding the child care that your participants are receiving with Temporary Assistance for Needy Families, or TANF funds. TANF is one of the nation's most important poverty reduction programs. It provides cash assistance, work experience, other supports. It's helped millions of low-income families weather periods of financial hardship. But less than half of all TANF funds in 2016 were used to support what are called core services, cash assistance, child care, and work-related activities. A number of 8 states spent less than 25% of their funding on these activities. At the federal level, there have been some conversations around reauthorizing TANF, and it seems like that's an opportunity to increase the amount that states spend on child care and pre-employment, and make it easier for states to support that kind of work. Julie, can you talk about how you all were able to access TANF funding in Mississippi, and what has worked about the way that you're getting those funds?
Yeah, of course. So our organization, along with the Mississippi Low-Income Childcare Initiative, has worked with the Mississippi Department of Human Services for a very long time and built relationships with them for a very long time. And specifically, our Women in Construction program has served many TANF participants throughout the years of our program. But when we received our Department of Labor Strengthening Working Families Initiative grant, that grant is a 4-year grant that's really targeted at bringing together both workforce and childcare delivery systems. And so, of course, a partner of ours would be the Mississippi Department of Human Services. So we essentially met with them to talk to them about getting priority for women in our program to be on TANF. We thought that would be a great way to get this grant going and bring those systems together. And our state came to us and actually said, let's look at paying for the child care cost of participants in the program directly through the Women in Construction program. And so what we've been able to do with that, which is absolutely amazing, is really able to take that administrative burden off of women and take that on as a program, so she can get trained and go to work. And so what I mean by that is we have a grant from the Department of Human Services, and when we first got this grant, we went and actually, with the Low Income Child Care Initiative, visited over 100 childcare centers to see who wanted to participate in this program with us. We visited them to get a sense of who they were and also have them sign an MOU to see if they participate. And what we do now is we actually have a case manager on site who is a childcare case manager who has visited the centers, and they meet with students before they enroll to see what kind of fit is good for them and their family. So essentially what happens is a student will come in, we'll assess her and her childcare needs, and then our case manager will give her advice about different childcare centers to visit according to what her schedule is, where she works, where she lives, and they'll help them make a selection about that. So we actually pay the childcare center directly, and our students are able to benefit from that service. And so that really, what that really allows is that to be that administrative burden, and that burden to be taken off of our students and put on us, so our students can get to work and really become an asset to their employers. So when they're on those job sites, it really helps employers increase their retention and have women who are there and who are able to be in the industry because their childcare is provided and we're taking that burden on for them.
That's incredible, and it sounds like you, are really meeting that need that Melissa and Matt talked about so much in their introductions, and building off of the success that you all have had in the report that we talked about earlier. We make 3 big recommendations at both the state and federal level that really focus on how states and the federal government can help expand access to pre-employment, pre-apprenticeship programs, to broaden the pipeline of workers, and to childcare. And so the first of which really touched on what you were just talking about, Julie. How do we maximize the use of TANF to support work-based learning and childcare for work-based learning participants? The next recommendation that also builds on the work that you all have been doing is how do we facilitate better alignment between WIOA, TANF, and SNAP-E&T. TANF funding is obviously crucial to making childcare and pre-employment programs work. It's the bigger ecosystem, though, that provided through supplemental nutrition assistance programs, employment and training, the TANF agencies, and the workforce development system that can really help scale this kind of support. Funds under the Workforce Innovation and Opportunity Act, or WIOA, can be used to support pre-employment support services and childcare, but funding for WIOA has been cut by 40% over the last 2 decades, which means there's really limited capacity within that system to invest in these 2 services. SNAP Employment and Training, or SNAP-E&T, helps support employment and training activities of people who participate in SNAP, which is the nation's primary food assistance program. States can access federal funds to support their E&T program, but the process to do so is often onerous enough that it's a disincentive to states who are considering expanding these programming. We just saw a draft of the Farm Bill that came out earlier today. There's a National Skills Coalition's website right now that provides a little analysis of it. And implementation of this new Farm Bill could offer FNS the opportunity to issue guidance on alignment between E&T and WIOA. Melissa, what could this alignment look like for states?
So just building off of what you said, a little bit more about that process for states to participate in SNAP-E&T, and I know this is a refresher for some, but under SNAP-E&T, we know that states can receive both formula-based grants and then reimbursement grants. And under the reimbursement grants, the organizations who are serving SNAP recipients are eligible for reimbursement from the federal government for 50% of the cost of supportive services for participants. And that, of course, can include child care and pre-apprenticeship. And this funding source is uncapped. And that, of course, makes alignment of SNAP and WIOA particularly important, given the cuts that you mentioned over the past 2 decades. So what does alignment look like? We are encouraging states to state advocates and then agencies administering SNAP-E&T to partner with their workforce system. And we see three key benefits enable SNAP recipients to better connect to opportunities under WIOA, and for WIOA participants to more easily access support services under SNAP ENT. One example from another state before we get into the Mississippi example is in Tennessee. The SNAP ENT agency and the WIOA agency in Tennessee are partnering because there are certain on-the-job training opportunities that are only available through the WIOA system that they want their SNAP participants to be able to access. So that's why they are partnering together. So that's one key benefit. WIOA, another benefit, of course, partnering is that WIOA can serve as a referral source to connect people to SNAP ENT programs. And these SNAP ENT programs sometimes can be much more focused and targeted on people with low income. And then final key benefit is that SNAP ENT, which I alluded to earlier, can add support services like pre-apprenticeship, like childcare through that 50% reimbursement grant, and that can supplement WIOA funded training. And that, of course, is a key benefit. And one key point to remember in all of this is that if this alignment doesn't happen, then you may end up in some states duplicating services, and that's something that we don't want to see given the limited amount of resources that we have out there.
Yes. Matt, can you talk a little bit more from the Mississippi lens about what has this alignment look like between WIOA, SNAP ENT? How could the state further that alignment too?
Yeah, sure. So our state did, we have submitted a combined WIOA state plan, and we did link that state plan to our TANF state plan. And I think as the WIOA state plan was being finalized in 2016, there was a lot of appetite for aligning systems and approaching workforce training and how services are offered at our Workforce Investment Network job centers, sort of how we can align all of those systems and approach it with a sort of quote unquote no wrong door approach and address the full needs of individuals as they come in to get work training services. The Childcare Initiative and More Community House, we were involved in the state's WIOA implementation and planning process over the course of 2016. And specifically as a participant in that, in the implementation, we made the case that single parents have unique barriers, specifically childcare, to not only working but upskilling and getting into better paying work. Our experience is that single moms and single parents work. They just often don't have the opportunity to get connected to training or education that places them in a living wage job. And so there was this sort of idea that parents in Mississippi faced this particular barrier and that we needed to do something to mitigate the impact of that barrier, the lack of affordable childcare for parents. And so as our state was working through how to align these big systems, we also received a SNAP Employment and Training pilot grant. And the approach for that particular grant and the awarding of that grant and the approach kind of coincided with the state lifting the waiver from a 3-month time limit for able-bodied adults without dependents receiving SNAP benefits. And so our SNAP ENT alignment has, in terms of alignment with WIOA, has served primarily ABODs throughout those pilots. And that's a good approach. I think in terms of looking at where we are now, considering the affordable childcare need and what parents need to get into better paying jobs, we are exploring an approach that would allow us in our state to take better advantage of the 50% reimbursement program that Melissa mentioned. One thing we in Mississippi have not been able to do is take advantage of that reimbursement program. And we really think that bringing SNAP ENT 50/50 into the picture would really expand services to parents who are receiving SNAP. We know we have a lot of single parent households receiving SNAP, and we know that what those parents will need to get into training and succeed in training is going to be support services, holistic support services, and specifically childcare. And I think we're at a place now where we have our state has this combined plan. We've sort of acknowledged that, and sort of that childcare and affordable childcare is really a really important need among low-income populations like the folks that Julie and Women in Construction serves. And that intentional linkage in our combined state plan has, we think, given us a good foundation to now look really intentionally and deeper at programs like SNAP ENT 50/50. And again, we're exploring a strategy to help our state take better care of that. And I think in terms of what we could do to further align SNAP ENT and WIOA, we think it's taking more advantage of the SNAP 50/50 program, specifically to expand services and offer childcare to parents receiving SNAP.
That's really interesting, Matt, and kind of puts a point in time in this conversation. So you mentioned that Mississippi is, and that you all are not currently accessing those federal matching funds in order to add more capacity and more funding to the programming that you're providing SNAP recipients. But there are some states that are already doing that. Melissa, can you talk a little bit about a state that is providing or is accessing funds, if there are, as another model for how that program could work to align with WIOA?
Sure. So the example that we point to a lot is Washington State in terms of accessing SNAP ENT funds, how community colleges there have accessed the funds and then partnered with community-based organizations in the state also to provide wraparound support services to people participating in training. And of course, those support services can include childcare. Other states are looking at that model, and I'm sure it's possible that some of our listeners today can provide some examples as well. I know that Georgia looked at that model too. They started with a focus on those able-bodied adults without dependents that Matt referenced, because of the specific time limits that apply to that population. But then they looked beyond that and also wanted to partner with community-based organizations who were providing other support services, including childcare, to participants beyond that population. So that is what they are looking to do now. And that's, we're seeing more and more states actually avail themselves of this opportunity under SNAP ENT, which is exciting. It just takes time and planning.
That's really interesting. And yes, if there are folks on the webinar who are part of those programs or have other stories to share, that would be really interesting. Both the chat box and the Q&A box in your toolbars are places to submit questions and share anything that the folks listening would like to with the speakers and other participants. And I'll turn to those questions after one or two more to the panelists. So the third recommendation that we highlighted in the report and framing the conversation today is the idea of creating work-based learning support funds. There's been a lot of focus at the federal level and state level over the past few years on apprenticeship and work-based learning. the government, federal government, Congress appropriated $160 million for in the latest appropriations bill for apprenticeship, and has appropriated hundreds of millions more in the previous couple of years. And a lot of this money has gone to states to help them support innovative and expansion of apprenticeship. Some has gone to national groups to support pre-apprenticeship programs in the form of intermediary contracts, either targeting particular industries that are using or could be using apprenticeship more, or to support the ability for underrepresented populations to access apprenticeship in a way that they can't right now. But future investments could include funding that specifically target strategies like pre-apprenticeship and childcare to expand this pipeline of workers with access to and success in apprenticeship programs. Since outside of having congressional restrictions on the kind of funding, or having DOL create restrictions in how they're spending that funding, Melissa, can you talk about what state allocated funding to address that alignment would do that simply aligning programs and aligning planning for the different programs wouldn't do alone?
So we've talked about TANF, we've talked about SNAP ENT, and it's important to note that we're talking about these programs because, and Julie and Matt in Mississippi availed themselves of these programs, partly because the primary source of federal funds for child care, the Child Care and Development Fund, that funding is also inadequate to meet the needs. We know that what they call CCDF, Child Care and Development Fund, they just received an increase in funding in March 2018, which was over $2 billion, and that's a great investment. But in the words of our friends at the National Women's Law Center, that doesn't compensate for years of inadequate funding. And in their latest report, Overdue for Investment, they document how 19 states have placed families applying for child care assistance on waiting lists, or they've frozen intake, which means they've turned away eligible families without adding their names to a waiting list for child care assistance. So in our report, in our Broadening the Apprenticeship Pipeline report, we talk about how child care and other support services can be costly, and as you said before, Katie, this current funding our current funding sources are inadequate, or they've been cut over the past few decades. So it makes it important for states to establish their own state-funded work-based learning support funds. And this helps to finance and support services for people with low incomes during both their pre-employment training and work-based learning itself. And one key advantage of work-based learning support funds financed with state dollars is that they can leverage other federal funds for these services, such as those SNAP ENT 50/50 funds that we were just talking about. Another option that we mentioned in the report is setting aside a portion of your federal expansion grant funding for child care for work-based learning participants. The bottom line is that these are expensive programs. Child care is very expensive. You, of course, can ask any parent or anybody who knows a child for that. So that if we don't specifically allocate funding for child care and other support services, if there's not a specific pot for that for work-based learning, it won't be included. And I think Matt wanted to tell us more about why state funding is so important in Mississippi.
Yeah, well, just I think that was I don't have much to add to that other than just to echo what Melissa just reported, and just to mention that the federal increase in CCDF discretionary funds is welcome news, and it it has been really incredible to receive that infusion of childcare assistance dollars in our state, and that federal increase came at a time when our state CCDF pending funding list, which is the waiting list, had sort of ballooned to a little more than 20,000 children. And I'm happy to report that since receiving the increase in CCDF funds, Mississippi has opted to use the increase to serve those families that had been on the pending funding list for quite some time. And so that pending funding list has been almost entirely served, if not entirely served by this point. But the thing I would underscore is, while that is very welcome news, it still only meets and allows our state to meet a fraction of the need among low-income working moms and their kids. And when a parent is able to access childcare assistance, it makes the likelihood that she enrolls in and completes training programs more likely. And it also gives her child an opportunity to be in an early education environment. And the approach is really in alignment with how our state looks at human services work broadly, which is always impacting two generations. And so while the federal increase is again welcome, it's still inadequate to meet the needs. So greater alignment and greater state investment in childcare as a work support specifically is still really needed. So I just wanted to mention that.
That's fantastic. And Julie, can I circle back to you? We've been talking a lot about some of these supports, both from the pre-employment side and the child care side in kind of abstract or state level terms. Can you paint a picture or give us an example about what having 12 months of paid child care means for your participants?
Yeah, of course. There really aren't, like, there isn't a right way to put it. It's a very epic thing, to be honest, because a lot of women haven't been able to participate in training or gain employment in a high wage career, and they've been historically unable to because of that barrier. So when you remove that barrier, right now our placement rate is at 81%, which is the highest it's historically been. And that's a number, of course, but when it comes down to actually how it affects an individual's life, we have students who have moved from Jackson and from other states to take this because it's such a huge benefit. And we see, like, I'm thinking of one student in particular. She came here and was working 2 minimum wage jobs and has 3 children and was able to relocate here, get a job, is now in an apprenticeship program, earning $21 an hour, making 3 times the amount of wages with benefits because that, and would not have been able to do that unless the child care is provided. So it's just seeing the faces of our graduates when they come into graduate meetings and how it's really sort of epically changing lives is something that's really beyond words, and something that we're doing our best to illustrate and capture through these stories, because it's so meaningful to see how it truly does change the community and the workforce around here as more women are getting into the trades.
And on the flip side of that, you've had conversations with some of your business partners about how important they see what you're doing too, right?
Of course. And for them, they've reported that the retention rates are, of course, better, but it's just a great way for them to vet candidates that have gone through our program, and they know that we're taking care of the child care, and so that our students have gone through our program and have done a good job, and that we're taking care of the child care, they feel much more secure in finding or from hiring people from our program directly. So it really is an on-ramp for them, but has also increased their retention and success of their employees.
One other question we had from someone about the other challenges that your participants face, Julie. In addition to some of the child care programs, there was a question about how folks are finding the right child care program that fits with their schedule. Can you talk a little bit more about the case management that you all do and how, and your, the child care coordinator that you have on staff?
Yeah, of course. So to speak to like the scheduling, that's something when our case manager, child care case manager visited the centers, they did a survey of the centers actually to see what their hours of operations were. And so generally when a student comes in to do our case management assessment, we look at, okay, so this training is from 8 to 5, Monday through Thursday. Do you have to work? We look at their schedule. So we're matching them up with a child care center that meets their schedule. So we have to pay attention to night care. We have to pay attention to, where the student lives and to the hours of both training and employment they have to make sure it's a good fit for them. So that's something we pay attention to all the time and have to really just find a good fit for those students. And then additionally, as far as supportive services, the word comprehensive supportive services is used on the regular, but what we mean by that is really looking at everything that would be a barrier for a family. So looking at childcare, transportation, housing, healthcare, and making sure that we're addressing all of those things within our assessments in the beginning and also throughout our curriculum. So those things are also embedded into our programmatic design.
So participants get that kind of support at the beginning and then throughout the program and then for the time period afterwards.
Yes, exactly.
We have another question about where folks on the webinar can get data or information about what the state is doing to ensure alignment between WIOA, TANF, and SNAP. There's data statistics, but you can check out their state's WIOA plans. So states have to come together both at the state level and the local level and create these plans about what they're going to do to support workforce development in their states or local areas. And many of the states, and this is what, Matt, you were talking about, in the intentional alignment that Mississippi state plan had between SNAP and TANF and WIOA. And so other states will have a focus on at least some of this alignment in their WIOA state plan. Melissa, can you talk about other places that folks can find this out?
Sure. So you can also check out how your state is spending their TANF dollars on the Department of Human Services, Health and Human Services website, on the federal website. And if you need some specific help finding that, of course, you can reach out to us here at NSC. And then for SNAP ENT information, of course, the WIOA plan is one place to look to see whether there's alignment, but the TANF and your SNAP ENT agency, and in a lot of states, they're under the same agency, so you should be able to check with them on that spending. And once again, we here at NSC, especially our state team, we're here to help, and we'd love to help you kind of navigate that.
And that kind of feeds into one of the other questions that we've got from folks. And Julie, when we were preparing for this presentation, you suggested that this is something that you get a lot, which is the question about where folks can start. How do you, I think that, outside of just finding out what your state is doing now, how can people on the phone start working with state policymakers and be involved in some of the federal policy conversations, but really from your own example, how do you access these funds to support pre-apprenticeship and childcare?
So yeah, I do get asked that a lot, and of course it's an extremely complex problem with no simple solution, and every state has its own challenges, and federally we have different challenges. But I will say for us, linking up with the Low Income Child Care Initiative. So the Mississippi Low Income Child Care Initiative is a policy advocacy organization, and we're a direct service training provider. And that was very critical for us to work with the policy advocacy organization who knew a lot of these state and federal, regulations and how to use these funds in a way that was creative. So it was very helpful to have those kind of partners. And I will say too that, a lot of times it's whether, I don't know exactly who's on this call, but industry and apprenticeship programs and different workforce development agencies have asked how to get involved with this and how do we go forward. But I think just making sure in all of these WIOA meetings and childcare meetings that we're constantly, or especially WIOA meetings and workforce development meetings, that we're bringing up childcare, and we're bringing them up because it is an equity issue. We're not going to have as many women participate in the labor force and be successful in apprenticeship if we don't include childcare. So I think we just need to keep on bringing that up in these conversations and spaces, and of course using national partners like the National Skills Coalition and other national partners to really discuss some of these very complex issues to get to the bottom of the childcare. And so we have a guide that is available, and I will also extend an invitation for people to reach out to us on the policy end to Matt with the Long-Term Childcare Initiative, and with me too as a program that started this, and how we figured out and got through sort of the weeds in all of this, that I'm happy for anyone to reach out to ask any questions as well.
And we can share Julie's contact information and Matt's contact information in the follow-up email along with the slides and webinar recording. And one other place where people can get involved in some of these conversations at the federal level is National Skills Coalition hosts our Skills Summit. It's this February the 5th through the 7th, and in Washington, D.C., and we'll be doing some meetings and prep for folks to go up on the Hill and talk to policymakers about the importance of federal policy supporting these kind of services for pre-apprenticeship and for childcare to help broaden the apprenticeship pipeline. There's still time for more questions, but at this point I'm going to turn back to each one of the presenters and give folks a couple minutes each to share any closing thoughts and tie together some of the different conversations that we had around what states can do, what the federal government can do, the importance of alignment between the workforce system and human service agencies, and how we're connecting the dots between what participants need as far as an on-ramp to training and an on-ramp to an apprenticeship program through pre-apprenticeship training, and then the kind of supports like childcare that we know make that pathway not only accessible, but enable participants to persist and succeed along it and get to the good jobs and stay in those jobs. So Matt, maybe I'll start with you. I should have given you a heads up on the order for this piece.
Sure.
But Matt, maybe I'll start with you and see if there are any final comments with a Mississippi lens, and then turn to you to complement that, Julie, and then have Melissa close it out.
Sure. I mean, I think the biggest thing that I would want to leave folks with is that parents who have childcare are more likely to enroll in and complete training programs. And that is a point that is really very well made and argued in the National Skills Coalition report, Broadening the Apprenticeship Pipeline. And I think what states can do, what the workforce system in states can do, is look at childcare as through the lens of a working parent. I think that it might be the case that you look at women in construction and you see you might say, oh, well, this is this unique example that has the benefit of these funding streams. But I think that there are best practices that have emerged from the women in construction model that can be adopted by any training program or any WIN job center in any state. And so I would encourage folks to think about how to prioritize single moms, specifically for middle skills job training, and adopt the best practices for serving women in their state systems, in their private programs. I think that we're in a place where we have this appetite for systems alignment and an increasing sort of support for apprenticeships and work-based learning. And I think that we should be really intentional in our state about identifying where apprenticeships and work-based learning opportunities are relative to where populations who need access to those opportunities are, whether those are populations like folks receiving SNAP or TANF or CCDF. and work with employers in the human services system and work with training providers to make those connections. And I also think we should look broadly at the, sort of the full spectrum of work supports programs. Like in our state here in Mississippi, we have our Childcare and Development Fund program, CCDF, and we know that about 70% of CCDF recipients are also receiving SNAP. We know that more than 80% of CCDF recipients are working or attending some job or a training education program, but only a very small fraction are receiving core and intensive services through WIOA. And I think looking at CCDF and other programs in terms of how do we align those programs with TANF and WIOA and SNAP, and really just being very intentional about identifying scenarios that people are in. Where are the populations who are receiving SNAP and childcare, but they don't have access to a work-based learning opportunity, and how can we provide that access? Or where are populations and people who are receiving maybe SNAP or CCDF, and maybe they're not receiving a work-based learning opportunity or any kind of opportunities for apprenticeships, and how do we identify when people have the supports they need but not the job training, and then the job training they need and not the supports they need, and how do we bridge those gaps? And that's where we are now, and we're in the weeds of it every day, and that's really, I think, where increasing women's economic security here in Mississippi, that's sort of really central in our efforts to be successful at that. So that's what I would want to leave folks with, I think.
Thanks, Matt. That's fantastic. Julie?
Well, Matt said a lot of what I wanted to say, but I will say that I do think this is a very unique time in terms of both the appetite that people have to talk about childcare, and how everyone is really realizing that it's a major workforce issue. And if we don't address it, we're not going to be able to meet our workforce needs. And I will say that providing childcare and job training in a high-wage career in a non-traditional occupation is one of the most impactful things we've ever seen. And as I said before, it's a very complex problem, but it's not a simple solution. But I do think sort of the corners of influence people have, if you're out, if you're on the call and you're an industry partner, bringing that issue to the table is critical, whether it's with a state policymaker or whether it's having some kind of roundtable. Just creating spaces to have this discussion is so important. And I want to say that also building something around the needs of what parents have is so critical. Oftentimes people say, we're gonna provide childcare. It's that simple. Well, it's not that simple. It's really is being responsive to the needs of the community, and for us, that's for women. And saying, okay, what do you need, and building a program around that. And so I think if there is funding, I know funding is one huge step, but if there is funding, think about how you're going to really build something around what people want and need, because that's what works. And seems very complex for others, but it's actually quite simple to create something around what parents need. And we found great success in just listening. And then just lastly, I will say, please use this as a resource, because I think that, based on what we've learned, we can really help regardless of what state you're in. And, we're in Mississippi in the South. It's a very different environment, but we'd be happy to help in any way possible to get this going, because it really is a critical issue that we can help with.
That's fantastic, Julie. And again, for folks on the phone, we will circulate contact information so that Julie and all the folks on the line can be resources to you. Melissa, I'll turn it over to you for the last word.
Sure. And before I give you my closing thoughts, I wanted to address one last question that we received. And the question was specifically about people are getting paid through work-based learning, through apprenticeships specifically. Why do they need help with childcare? Because they are getting paid. And that is a valid question, and something that we addressed in our report, our Broadening the Apprenticeship Pipeline report, we talk about how starting wages for our apprentices can be lower than what they expect to make over time, because wages increase as apprentices gain more skills. So it's very important for apprentices, especially in those first few months of an apprenticeship, to have access to childcare. And of course, before they start an apprenticeship, when they aren't receiving wages, in a pre-apprenticeship program, childcare is all the more important. So just wanted to address that. And as far as closing thoughts, I think we've talked about a few different strategies that I just wanted to reiterate. We've talked about aligning federal funding sources, TANF, SNAP-E&T, WIOA, child care funding, and Julie and Matt have done some great things with existing federal funding sources, with TANF specifically. And so that is one great starting strategy for states, for both state advocates and state agencies. Another strategy that we've talked about, of course, is allocating state funding specifically for child care and for pre-apprenticeship, for work-based learning supports in general. And that is, of course, kind of the next level in terms of strategy. Once you've aligned all your federal funding sources, then you have to think about, okay, what else does it take to meet the needs? And a lot of times that is that state funding. And then Julie brought up a great point in that state advocates and state research organizations like the Mississippi Low Income Child Care Initiative can be a great resource for you all in trying to figure out what's going on in your state and how to advocate for more funds, either state funds and then on the federal level. And then Katie brought up how you can advocate on the federal level, specifically through NSC via our Skills Summit, for protection of some of these very vital funding sources. So we've left you with a lot of ideas, so you can kind of choose your own adventure and where you want to start.
That's a perfect way to end it. Thank you to everyone for participating. Thank you to Matt, Julie, and Melissa for sharing their expertise. We will again circulate this, the webinar, the slides, and the contact information of the presenters to everyone who signed up for the webinar. Thanks, everyone.